Julie. Well, it's that time of year when kids can't wait to get outside and play, right? They want to ride their bikes, just let off some steam. But it's also time for parents to be extra watchful if children return home unusually tired. Maybe they have a shortness of breath. Those reactions could mean the onset of asthma. Joining us this morning with more, Dr. Marla Shuman with Pulmonary and Critical Care Specialist of Northern Virginia. Dr. Shuman, good morning to you. Thanks for coming in. So those are just some of the symptoms. We might not think our kids suffer from asthma, but there's some things to look out for, especially this time of year. Tell us about those symptoms.
Well, especially cough. I think that a lot of kids will cough. You might feel, they might describe some chest tightness or just not being able to keep up with their peer group or to perform or exercise at the level that they usually do.
Okay.
And it can be extremely variable. I think that's really the hallmark of asthma, is that it comes and goes and that it can change over time or with different triggers.
Right, and we're looking at some of the symptoms. You said shortness of breath, that chest tightness and pain, trouble sleeping.
Well, in fact, a very major aspect of asthma is nighttime trouble.
Okay.
Kids might wake up, toss and turn, or cough at night.
Mm-hmm. And the last one was wheezing. That seems like one of the old-time symptoms we're used to listening. Should we listen for that if we think they have everything else?
In point of fact, all that wheezes is not necessarily asthma.
Okay.
You know, if a child wheezes, that could be a sign, and it probably leads to the need to be tested, to be seen by the doctor. Mm-hmm. That all children who wheeze may not really have asthma, but it is certainly a symptom.
Okay, and let's talk about that testing. Yeah. What might a child go through?
Well, usually we would put a patient on a spirometer. It's a test where they clip your nose and ask you to blow forcefully into a machine that measures the rate at which the patient can exhale.
Okay.
And it does measure lung function. It's a very simple test. Even a small child can do it. In your common primary care physician's office, they may have a simple machine or even something called a peak flow meter, where you can get a number that compares to other children in your size or your peer group to measure lung function.
So before they come to see you, they might be able to get that first level of care at their own pediatrician. Let's talk about this time of year. People who don't even have allergies are feeling the effects this time of year. Is it worse for people who suffer from these respiratory issues?
Well, it's funny because when you look at the cars all green, from all the pollen and everything, you think, how can anybody not have trouble? But in fact, about 10% or less of the population really have true asthma, a response to the allergens in the air, and this sets up a pattern or a pathway that leads to inflammation in the airway and narrowing of the airway.
Okay. And we saw some of the triggers there, of course, the old familiar foes, grass, tree, and weed pollen, airborne mold, and also just the extreme heat as well.
The heat really is a sign of just heavy air, a lot of stuff in the air. The sunlight. Sunlight triggers the ozone and causes particles that are more damaging to the airway. And when you exercise outside, you're going to take deeper breaths, and so you're going to get this in deeper.
There are some ways, some tips you passed on about, if you have these, you might want to pay close attention. Parents should be also alert if you say a child is unusually tired after playing. We talked about that one. But also no desire to play. Maybe they know they're going to feel bad after that. And a family history. So genetics plays a role as well.
Absolutely. And also smoking in the household.
Okay.
That's really a big problem.
Who smokes now?
Unfortunately, people still do.
All right.
It keeps us rich.
Great, thank you. Great tips. This is Dr. Marla Shuman with Pulmonary and Critical Care Specialist of Northern Virginia. The fun doesn't have to stop for kids, but know what to look out for.
Absolutely.
Okay. Steve, back to you.